Dr. Chan Wyman, you have a lab that makes trays, and these trays are held in very high regard. This man who owns a lab, who supplies teeth whitening trays to the world, is now talking about trayless. That, to me, was very interesting.
That's why I like to use the word conscious bleaching. If you bleach your teeth at night, when it started to hurt, you're already asleep. And that pain is so mild, you won't feel it. Over 3-4 hours, when you wake up, it can be quite intense. And that's why I always prefer conscious bleaching. Do it when the patient is awake. It's conscious. You can do conscious tray bleaching as well, but the diffusion will be a lot higher. You can get to the pulp easier. If you paint it on, I only need to get your teeth. That's it.
What I've realized is with my tray system, when I get them back and see the trays is manky. You can see your patient's aligners, the retainers, they're manky. And we realized that actually most of the gel is used to clean the trays instead of whitening the teeth. That's why people with better oral hygiene gets better results.
Yeah. Imagine getting amazing whitening results for your patients. Tough cases like tetracycline staining or non-vital bleaching, all those cases with white patches and perhaps post-orthodontic demineralization. These are some of the tough cases that we do. But imagine you can get exceptional results without ever prescribing a whitening tray. And I don't mean doing anything restorative. I still mean doing whitening with a bleaching gel, but at no point does a patient insert a whitening tray as we know it into the mouth. And no, I'm not referring to whitening strips. I'm actually referring to a system whereby the patient applies the gel to their teeth. They literally paint on the gel. And so you're probably thinking, why? Why bother? We have this great tried and tested system of teeth whitening that's been around for decades and decades, and we can get great results with traditional whitening trays and something like hydrogen peroxide gel. So why skip the tray? Don't we need the tray to create a reservoir, to create that seal? Well, the answer to that, my friends, is a big fat no. You don't need a tray. In fact, it's often advantageous to do it without the whitening tray. You'll get less sensitivity. It's faster because you don't need to wait for a lab to make you trays. And because of all that, it actually becomes more cost effective to do. And these are just some of the benefits that Dr. Wyman Chan, our guest, and Dr. Elvis Law, who's essentially his protege, have joined me in this very special episode. I recorded this in his central London practice, and all around me were these photos of Dr. Wyman Chan standing next to these smiling celebrities from Nicole Scherzinger to Danny Minogue and everyone in between. Dr. Wyman Chan is one of the most prominent figures in the world when it comes to teeth whitening. He got his PhD in it years ago, and then that's all he did. He just exclusively did teeth whitening, and he did it in the highest expectation patients. And what he doesn't know about teeth whitening is not worth knowing. So whilst this episode is quite fascinating in terms of how trayless bleaching can and should form most of your bleaching protocols that you do actually, but you'll pick up all this wonderful science behind whitening and expectations management. And so in this part one, we talk about how on earth does trayless whitening work, why it's superior, when not to use trayless whitening, and we talk about your standard case, an A3.5 shade patient, and what is the exact protocol for trayless whitening. Now in part two next week, we talk about how you can apply trayless whitening to tough cases like tetracycline staining, non-vital bleaching, and those white patches on teeth. And so we go deeper into those three scenarios next week. But for today, enjoy this part one. Now every PDP episode, I give you a protrusive dental pearl. The pearl is inspired by something that was said in this episode. When Dr. Elvis Law explains his protocol as taught to him by Dr. Wyman Chan, interesting thing is all about communicating how white a patient wants to go. Now, historically, I've asked the patient, how white do you want to go? Do you want to go Hollywood white, Simon Cowell white, something from Love Island, or something a bit more natural but still white? And I kind of give them these descriptors and they get a laugh. And then I take the shade photos and I show them what B1 looks like. And that's the way I was taught, and that's the way I've been doing it. But a small little distinction that Elvis taught me was that he shows all the shade tabs to the patient. He says, well, this is where you're at. How white do you want to go? And the patient chooses their desired shade. Let me say that again. The patient chooses their desired shade. And then there are the standard shades, which is like B1 is like the whitest. And then there's the Hollywood shades like the OM3, OM2, OM1. So by doing this, you now understand exactly what the patient's expectations are, and you can track it with photographs. And more importantly, what they choose will determine the price. So rather than having this one standard fee for teeth whitening, it should be, and this is what Wyman teaches, how to price appropriately, but the shade they choose will govern how long it will take and how much gel they'll need to use, how many reviews they'll need. And that, my friends, is how whitening should be fairly priced. If someone starts from a C4 and they want to get an OM1, it is actually possible, but it'll take a lot more time, a lot more reviews, changing protocols midway through, and that needs to be priced in. Now, only you can answer what that looks like in your practice, but maybe it's time for you to sit together as a team of dentists and therapists and decide, how are we doing whitening? Do you have just 2 tiers, or should there be more tiers based on the starting shade and the desired shade and how many weeks it will take and how much gel the patient will need? And you're gonna take away a lot when it comes to communication from this episode and the next one. And these are exactly the type of episodes our members love, because when we make the premium notes only available to our premium members, we see a huge spike in downloads, and very often our members send in the photos of them annotating and really cementing what they learned from the podcast. If you're not already on Protrusive guidance, part of our membership, this episode might spark you to finally consider that. For our 1,000+ members around the world, you're gonna love this. Please do download the premium notes below. And of course, we'll be feeding this into Ask Jazz. So in the future, when you have a case-specific question, we'll be able to pull from the wealth of knowledge that's shared in these 2 episodes. Let's join the main episode and I'll catch you in the outro. Hello everyone, I'm joined today by the Dr. Wyman Chan. I've got Dr. Elvis Law as well. Just to give you a background for those listening right now, I'm near Shaftesbury Avenue, central London. I've got Dr. Chan and Elvis next to me, Wyman and Elvis. Behind them are these amazing photos of all these celebrities. I've got a great view of Nicole Scherzinger right behind me, and all these celebrities have a teeth whitening here. And as you walk through into the practice and you see, teeth whitening science, guaranteed results. And I'm just so excited to be here in a rare live filming episode. So thanks so much for joining us. We are in for a treat because we're talking about trayless whitening, right? When I first came across trayless whitening, when Wyman told me about it, I was like, wait, what? Is this like strips? Is this, do you mean whitening strips? What's the point? Why? When? So I've got like a gazillion questions to ask, and I'm so excited to do so. But for those of you who have been living under a rock and you haven't heard of Wyman Chan before, a little moment to please reintroduce yourself. I know you've come on the podcast before, but they may not have listened to that episode. And that episode was really brilliant on all our community questions on teeth whitening. So Dr. Chan, Wyman, please tell us a little bit, remind us about who you are, what you stand for, and your interest in teeth whitening.
Well, thank you, Jess. Thank you for inviting me again for another podcast. I'm really humbled to be here and share my experiences with everyone. In fact, I'm just a simple dentist like you all. I have a special interest in teeth whitening, and I became a tooth whitener 24 years ago, 2002.
Back when it was illegal.
Okay. It was illegal, but very difficult. That's when I started my whitening center, or we call it dental bleaching center. Really difficult because all we were doing were illegal, but that's why we could not promote in a way I like to. Even though that we didn't promote a lot, but we still get a lot of coverage. So I'm just a simple tooth whitening dentist. That's why I am, and that's my passion. I love teeth whitening. From teeth whitening, I developed a lot of innovations, and hopefully we're going to talk about prevention later on. So that's it. I'm just a dentist like you guys.
And Elvis, tell us about yourself.
So I am actually a baby dentist. I mean, I don't know if I can still call myself that. I've only graduated from BART in 2020, so I've only been working as a dentist for about 6 years. But I'm very lucky to be hired by Dr. Wyman Chan straight after FD. And working as a...
What a great mentor to have, right?
To have a great mentor, working in the private practice straight away. So yeah, I'm just really lucky to be hired by him. And I've started the journey since I graduated.
What do you like to do? Are you also passionate about whitening? What are the other interests that you've developed over the years so far?
So I am very interested in whitening because I have a great mentor here. I have just finished also an MSc in implantology, clinical implantology in University of Central Lancashire. And yeah, I've just graduated from that. Well, I've just passed my exam for that.
Congrats,
yeah.
Congrats. Great.
Congratulations.
Thank you.
Yeah, well, you're going to be sharing 4 scenarios with us today, whereby that involves an element or exclusively trayless whitening. So I pitched this question to you guys in the Protrusive Guidance app, and you guys had the same questions that I have, right? Trayless. Right. Trays are so important. We were taught that trays are crucial, getting the right tray design. And so what really interested me was someone like you, Dr. Chan Wyman, who you have a lab that makes trays, and these trays are held in very high regard, like a very high quality tray. So you need to get very well sealed, high quality trays. You need to get good quality gel, and teeth whitening, as we know, is extremely predictable. So this man who owns a lab, who supplies teeth whitening trays to the world, is now talking about trayless. That to me was very interesting, okay? So what do you mean by trayless? Do you mean strips, or do you just tell me about trayless and the evolution of trayless as you understand it?
Okay, trayless. We dentists were so used to using trays to do dental bleaching, and that was historical. More than 50 years ago now, we have been using trays, and I also have been using trays since 1991. Yes, trays are very good. I was taught how to do dental bleaching, doing home whitening mainly. But also, I also own a lab. I also have 4 patents on tray making, actually making bleaching trays, 4 patents. But how do I evolve from trays, from trayless? Because doing trays, I found it because I have a whitening center. That means I need to have a lab. I need to take impressions. I need to pour the models. I need to have someone to make the trays for me. That means that impedes a lot. When I decided just not to do routine dentistry, just doing teeth whitening, I always look at things, how to simplify the whole procedure. So I started looking at, can I do bleaching without all those, a lot of work, like making trays, the whole process of making trays. And so I started looking into this trayless system. Trayless, yes, the strips, I would consider that as trays. You still like a trays. But this is totally traceless. That means we use your retractor. You use retractor to extract the lip and the tongue, and also so that we can expose the teeth that we're going to bleach. And also, I think it's important that we can close the deal straight away, rather than have the patient go to wait for 2 weeks for the trays to be ready. That 2 weeks, they can change their mind. They may not want to do the bleaching anymore, and they want to do the refund. But with this, we found that closing the deal is a lot easier, and also that the patient changing their minds has gone down a lot.
Well, patients want, the reason they have the consult or they express that you have that discussion is because they want it. And when anyone decides they want something, they want it now, right? Yes. And so already I was thinking, why trayless? And Dr. Raquel Valenciam on the community, she mentioned about strips, and we'll just touch on that in a moment. But sometimes you have deadlines, you have a wedding coming up, you have this, and so the option of trayless when there's a time sensitivity or time urgency, it makes a lot of sense to me.
It is. That means the patient can start the bleaching straight away, rather than have to wait 2 weeks for the lab to get the trays made. And also, making trays is not simple. Firstly, you got to get every step 100% correct. For example, your impression got to be so good, and then the model pouring's got to be so good, and then you got to have a really expensive sat-down machine to make a set of very good bleaching trays. All those cost money and time. So just to avoid these 3 steps, that means imagine every step you make 20% mistakes. That's a lot of mistakes to make over the 3 steps. So with painting the gel onto the teeth, that means you get the active ingredients straight onto those areas, the yellow teeth, which is going to be bleached. Also, over the years, I discovered that with the trays, when the patient come back with the trays, they are so discolored.
The trays themselves.
The trays themselves are so discolored, just like retainers and just like aligners. They're so discolored. And then I look at them and say, why are they so discolored? And then with the discolored trays, yes, we put the bleaching gel in there. And then after a few days, and the trays got clean and really nice and bright again. So I realized that we'll be cleaning the trays with the gel. Such a waste. So now we don't clean the trays with the active ingredients anymore. We use the active ingredients for 100% bleaching.
Well, this reminds me of I know chair-side bleaching is reduced a bit. Most dentists are on to home bleaching with trays, but this reminds me of when I did chair-side bleaching, the patient comes in, you put the gingival mask on, and you put the gel on. It's now patients are getting to do this at home for themselves, really. So that's how patients can perhaps, dentists can relate to it, and patients can relate to this, the way of thinking. But just to touch on the lab fee, you skip the lab fee, which is a very, I actually didn't consider that. So yeah, the time and also laboratory fee and also any mistakes that happen in the tray production. But just, can you give us a final sentiment on strips? Is there a place for dental whitening strips in high quality bleaching?
See the strips. Let's just talk about my system, the system that we use. We use the double barrel system. That means we use two solutions or two components, and then we'll only mix it at use. All the other, if it's stripped, you cannot do that. Everything is already been pre-mixed and put onto the strip. So that's a problem with. I would say firstly is the how to stabilize the strip and how to stabilize the gel. All the manufacturers use strong acid to stabilize the gel. If you use strong acid, that means you need to use that to stabilize the strip. Using strong acid, that means you're making the preparation acidic. Acidic. We don't want to put acid over our teeth for half an hour, 1 hour, or even in some tray system overnight. You don't want to put acid over the teeth overnight.
You're basically etching it. You're
etching it. You just removing the enamel away from your teeth surfaces. So I do not like the idea, but there's a lot of the dentists still doing it. They love doing it. So if they like doing those like tray system, maybe they should go out and look for a less acidic preparation.
Your gels are alkaline, right?
Our gel
is that fair to say, or neutral, or
no, high alkaline?
Alkaline. Okay. And then the only reason that's possible is because they're the two double barrel and they mix at source.
They make at source.
So you don't need the acid to stabilize. Is that the simple mind technology?
We still need the acid to stabilize the bleach.
Okay.
Which is hydrogen peroxide base or carbon monoxide base. We need to stabilize it. So to stabilize it so it doesn't degrade, you do not lose the efficacy of the bleach, but we have the other components which we can make it alkaline.
Okay.
So we have a very stabilized and
is this a patent thing, a copyright? Like, is this something that only your gels do?
Yeah, only our gel do. Yeah, it's patented.
Okay.
It's patented. Yeah, it's very special.
Okay, so that's fascinating in terms of learning about formulation of gels and alkaline versus acidic, and then already said that trays are also the strips are also acidic. And really, do you think the kind of results that we're proud of when we post on social media and we show people, you really, my perception, I might be wrong, you can't get a really compelling before and after through just strips. Is that fair to say?
No, I think you can get very good result with strips as well, and that's why I teach. I teach strips in the Far East in China, and I wish some of you would come to my classes. That I teach very comprehensive on dental bleaching. So it depends. Everybody is different. The teeth structure is different. The way how the bleaching affect the color of the teeth is all different as well. Or, in fact, this is my PhD thesis. So it's a secret. So I only share this in my classes.
Fine, but so there is a place for strips. There's a place
for strips. They do work well, but the downside is that it's acidic.
Okay, fine.
It can damage your enamel. It's
so
acidic.
That makes sense in terms of the formulation of the gel. But let's talk about the indications for trayless. Now, interestingly, I remember recording with Dr. Linda Greenwald. We talked about sensitivity and teeth whitening. For those of you who are watching this, I'll put a link below to that episode. For those listening, read the show notes, and we always like to link back to older episodes. And the interesting thing she mentioned was a study whereby the variable that was changed was an element of the tray design. So if you use a rigid tray, it caused more sensitivity, even if you use like no gel, like even just without the gel and using a rigid tray with no peroxide, you got sensitivity. So we know from studies like that that the tray design itself can influence sensitivity. So was that one of your rationale or reason for looking more into this trayless? That could it help me to deliver the whitening result with less sensitivity?
That is one of the factors when I invented a trayless system 20 years ago, literally 20 years ago when it was illegal. In those days, I had a very big dream, really big dream. We went to the Ideal Home exhibition in Oscott. We actually exhibit there for 1 month, and in those days we only used 6%. After a week later, I was there nearly every day. So a week later, at the exhibition, I found a young lady just looking for something. And then finally she came to our stand and said, "Oh, I've been looking for your stand." I say, why are you looking for a stand? Only been there for 1 week. So a friend of mine bought a box, we had a box last week. And then a week later, she told me that her teeth are a lot whiter. Just a week. And that's when got me going. Why? 1 week we got such a good result. So I starting experimenting on the trayless system, especially with my bleaching center here. It saved me so much time and less fees as well. So, and it's a no-brainer to use a trayless system. And to talk about sensitivity, yes, because our trays do cause sensitivity because it is you're holding the gel in for a long time, and the gel got nowhere to go but all the way to the pulp. That's why if you paint it on, obviously the diffusion is much slower, and then the patient can control. That's why I like to use the word conscious bleaching. If you bleach your teeth at night, when it started to hurt you, you're already asleep, and that pain is so mild you won't feel it. But over 3-4 hours, when you wake up, it can be quite intense, and that's why I always prefer conscious bleaching. Do it when the patient is awake. It's conscious. That's why trays, you can do conscious tray bleaching as well, but the diffusion will be a lot higher. You can get to the pulp easier. If you paint it on, I only need to get to the dentist. That's it. Where the colors are.
Okay.
Where the color is.
That makes a lot of sense. And the whole conscious bleaching, guys, if it's the first time you're hearing this, you must check out the previous episode we did with Wyman, where the biggest takeaway that you guys messaged me and commented was the whole concept of conscious bleaching. I love it. Since then, I've been using that with my patients, and then family members who do whitening and say, okay, we're going to do conscious bleaching now. And a lot of people have switched over to that. It just makes so much sense. And this whole concept of if you have a tray, it's a closed system, and then the gel has nowhere to go except closer to the pulp. But when you don't have a tray, it's like it's lost to the air a little bit, but then it goes in perhaps not at a faster rate, which from my mind, it makes a lot of sense, because I read somewhere that the gel reaches the pulp within like 15 minutes in a tray system, right? Is that accurate?
Yes, accurate. Yeah.
Okay. Well, you've talked about, let's finally round off before we start talking about scenarios to use trayless whitening, the advantages and why you might consider trayless whitening. So you said speed. We said you get to eliminate a lab bill and any errors associated with the tray production. Less sensitivity because you get to do it conscious, but also the fact that it's not concentrated, it doesn't, it's not fast track to the pulp in that way. Any other advantages of trayless? Before that, then I will ask you, who's not a candidate for trayless?
Okay, the trayless system, I agree with all you said is all valid. But another important factor is that because we're not passing on to the gums, so if you can accident, if you use a trayless system, you accidentally paint it on the gums, you will not burn gums. You will not feel any. You do not feel any irritational pain at all. But
why is that? Sorry. Why would you not feel it on the gum if you paint it on the gum?
Because we have saliva, we have cortical fluid, which dilate that really fast.
Okay.
But when you're in a closed system, you just, the gel will push in deep into the soft tissues.
Okay.
And that will cause inflammations, and that can be very painful. Okay. So that I would say to avoid pain, the trayless system is amazing system.
Okay. And then my question is then, when would you want to use the usual way that we all trained on, which is trays? When would you say that actually, patient, you are not suitable for trayless, we should go for trays? Are there any contraindications for trayless whitening?
For trayless whitening, there's no control, and unless those people do not like to have, like we have a lot of young ladies, or not young ladies, people have their fillers treatment, and they say, oh, where the retractor is just half an hour the treatment twice a day. So would it make my wrinkles more obvious? That's what you worry about, the lines, near the lips, and
So the wearing the retractor itself, right? For actively,
this is
the stretching.
the stretching. This is the most common question and the concern from the patients. But we told them that there's no evidence that it will increase the wrinkles on your mouth and the face. But after half an hour, they would disappear. So a lot of them believe that, and they tried it. But some non-believer, they probably spend a lot of money on Botox and fillers, and they didn't want to risk it. And these are the patients we prescribe trays to them.
Okay.
Yeah, and also for trays as well. Trays is not suitable for praxis, people who grind their teeth at night. So it's definitely not suitable.
Because the gel will leach out.
Will leach out a lot as well. And also you can easily bite the holes into, because most of the trays like bleaching trays, they are soft. After a week or two, you make a lot of holes onto the bleaching trays. So these are the two things I can see the pros and cons.
Well, I need to learn a bit more about the protocol and scenarios. So maybe I might say this at the end, but in my mind, I'm thinking there is a certain type of patient, because you just said already, twice a day, half an hour. But when you have that retractor in, when you paint it on, you can't talk. You know, you have to not talk. So with a whitening tray, you can still at least have a conversation. Is that a potential advantage of trays, of a tray, in terms of how it fits into your lifestyle?
It is. I always ask the patient that we have two systems. Even though we tell them we have two systems, and then I give them a pros and cons of the two systems. I say, can you find half an hour twice a day, sit down and relax? I think you deserve the time not to do anything. So just chill it out for half an hour twice a day. It's how you say it. And people love it. I say, just chill. I say, do you have any, if you do in the office, if you're a boss?
They probably come back with better mental health.
Yeah. And not only that, just get the stuff painted for you, just sit there and enjoy yourself. Just paint it for you, so easy, and just chill out for half an hour in the office. Twice a day, you can do it at home, and ask your children, play with them. They can paint it on for you. So, but if you cannot find that half an hour, you don't want to chill.
Got that CEO type, who's like bang, bang, bang. You know what? Maybe just go for the trays.
Yes. But a lot of, especially our women, because they love the tray system. They can see that just like doing fingernails.
I was just thinking that.
So easy. I say it's just like you do your fingernails straight away.
And then you can't do anything for a little while.
Yeah. Straight away they got it.
Yeah.
Nice. And a lot of people do really want to chill out for 1 hour a day, because I think we are too busy. We are looking at our computers all the time and handphone. I say that half an hour, just turn the alarm on and don't look at the handphone. Just chill out, close your eyes, and enjoy yourself for half an hour.
Very good. I recently bought a vagus nerve stimulator. I put it on my neck, right? And it's supposed to stimulate the vagus nerve to help me go into more parasympathetic. Because as you can see, I'm very sympathetic. So it helps me go into like rest and digest mode. But I don't know if it's actually the pulses into the vagus nerve, or the fact that I had to literally sit there and do nothing for 10 minutes that's actually causing the improved sleep score. I don't know which one it is, so to be confirmed. But okay, that really helps into understanding the pros and cons of trayless and who's the ideal patient. Now is a great time to just discuss scenarios with Elvis. Elvis, you've got 4 different scenarios in which you've used either exclusively, the whole case was managed trayless, or sometimes in combination, which I'm interested to know, okay, again, who's the ideal patient for a combination? And guys, I've seen these scenarios and they're fascinating and they're very real world. We have someone with a single central yellow tooth. We have someone who's just got A3.5, all the teeth are A3.5. We've got a few others with a bit more advanced patches and whatnot. So we'll discuss all these scenarios. So let's start with scenario 1. Which is the scenario 1, Elvis?
Sure. So scenario one is a patient that came in with all teeth with A3.5. You see that every day. You see it in your patients, in my patients, and they are happy with the shape of their teeth and the alignment of their teeth, so they just want to make it whiter. So in that case, I'll offer them, as Dr. Wyman Chen said, two options. You can either go for trace and non-trace.
Can I ask, how long have you been using the trayless for? Is it something that you're new to this? Because obviously you've been mentored by Wyman, you've been doing lots of cases with trays. How you found when you started to, maybe you had the same thoughts as me, that wait, trayless?
Yes, you know what, I'm so glad you asked me this question, because at first when I started as a baby dentist, I started with trace as well. So Wyman taught me trace first, and that was back in like 2021, 2022. And I saw all these pictures of his like amazing cases. And as a baby dentist, I'm like, I could never do this. No way I could do this. He has like 20, 30 years of experience. He could probably do it. I have no chance. So I started using it, again, seeing normal patients with normal like A3 teeth or A3.5 teeth. And sometimes I get them to B1 with trace, sometimes I don't. And I realized that when I get better results if the patient's oral hygiene is better. And then so I started cherry picking patients with better oral hygiene to do my whitening cases. And then what I've realized is with my trace system, when I get them back and see the trace, like Dr. Wyman said, the trace is manky. And you can see your patient's aligners, the retainers, they're manky. And we realized that actually most of the gel is used to clean the trace instead of whitening the teeth. That's why people with better oral hygiene gets better results.
Yeah, okay.
And then he introduced me to this TRAYLESS system.
You are now ready for TRAYLESS.
Yes. So, yeah, and then he introduced me to this TRAYLESS system in 24, and I went to Shenzhen to do a course with him.
Okay.
So the course that he mentioned,
yeah.
teaching. And after that, I become the only certified Dr. Wyman Chen dentist in the UK.
Sweet.
And I realized, oh my God, this is actually a revolution. And it is a completely new system where we actually paint the gel.
Well, but he's not new. He's been using it since 1991.
Yeah, he didn't tell me to.
Yeah. But that's amazing.
So now I understand why he can get all these results. In fact, if you look at the pictures, they're holding Get2Smile. They're holding the paint on system.
So look, guys, for those who are listening, like I'm in a room, like I said, and I didn't even realize there's more photos of celebrities behind me in this direction, right?
Fleur East is using Get2Smile.
Who is?
Fleur East.
Okay, okay, fine. Fleur East. Okay, sweet. So then they're using these trayless. So it's something you've been doing for a while. TRAYLESS system. Okay, fascinating. So you are very inspired by that, enthusiastic, and after going to China for that course.
Yes, and after that, so.
Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I want to do is create a really supportive environment that's not like the environment we have on Facebook, and is built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider it public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz, like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive Guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you do make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode.
I realized what we've been doing wrong. Why the secret sauce is that we actually need to paint the gel on the teeth so that it's not wasted. And that's how it clicked. And in the course he will teach you all from how to talk to a patient, how to close the deal, how to introduce the gel, and how to lay out the treatment options and all that, and how to price it as well. And I'm a really bad sales. I'm really bad at selling, but it helped me. So it was amazing. It was really good. Good learn.
I will personally give a class. I haven't been on your course in China. I'd love to visit China one day, right? And so I'm a big fan of like finding a course in a country they always want to visit, make the whole trip tax deductible, and I'm a big fan of doing that. So if anyone's out there wanting to go to Dr. Wyman Chan's course, I'll put a link below so they can get this awesome experience that you've had, because I've heard a few people talk about it now. So you came away from that invigorated, and then you started to apply the TRAYLESS protocol on your patients. So that scenario 1, A3.5, what was your rationale for going TRAYLESS? Is it something that you said to the patient, okay, you can either go Tray's method or TRAYLESS, and the patient picked, or because this was a combination case that, well, obviously we're talking about scenarios, but we're also talking about cases at the same time. So tell us about this kind of case.
So this can be done trace or TRAYLESS, as we said. In this case, in this scenario, we use a TRAYLESS system because the patient picked TRAYLESS, and the reason being is we asked the patient, so you can either do 30 minutes twice a day. In between, you only need 2 hours in between, and that's one of the big thing that
minimum of 2 hours.
Minimum of 2 hours.
But you can do like 6 hours later, right?
Yes.
Okay.
Yes. In between, and or we can wear the trays for 2 hours in the morning, 2 hours at night.
Okay.
And again, 2 hours in between, minimum. I asked her which one do you want to do more, and she wanted just a shorter wearing time.
I'm just trying to get the protocol right here.
Yes.
So the TRAYLESS is half an hour twice a day.
Yes.
But the tray is 2 hours twice a day.
Twice a day.
Understood.
Yeah.
Okay, fine.
Yeah. So one more benefit about being TRAYLESS is that your wear time is actually less.
But we're still respecting conscious bleaching. So it's up to 2 hours, and it's up to half an hour.
Yeah.
Okay.
Yes.
Okay.
So so she picked the shorter one, and what I tell my patients usually is you don't actually need to do it in the morning and at night. What you can do is do it first thing you go when you get back home.
6 p.m.
6 p.m. Yeah. And then make your dinner, have your dinner before you sleep, do it one more time.
Yeah.
And that's good enough. And I think that works much better in terms of like fitting in everyone's schedule. And they find it so much easier. And most of my patients, they wear a mask for their skin every night anyways, and they can just do it while they do that. So it's just like,
Is it like a standard, like the mask that we wear as dentists, like that's kind of mask they got to wear, or?
yes, and also they put a mask over
Face
their face, a face mask.
But this is something you don't supply the patient.
No.
Okay, in my mind, I was like,
sorry.
in my mind,
Sorry.
in my mind, you're giving the patient the whitening stuff, but they also give me, hey, have this facial mask as well. Okay, fine. So when they're doing some other beauty therapy, it makes sense. You're doing this thing, now you can't talk, and you're
it's like when you're doing your vagus nerve thing, you can do your whitening as well. I don't know if this is fine, right?
You can. It sounds like these little shocks, right?
Yeah.
But yeah, you can whiten. Yeah. So you're stacking beauty.
Exactly, you're stacking beauty together.
Because you're like, now is my beauty time. Exactly. I might as well get someone to paint my nails, put my mask on, and do my teeth whitening at the same time.
So that's
But they don't need to wear something on their face as a mask to contain to prevent.
They would have, yeah.
You can either wear COVID mask.
COVID mask,
or
yeah.
you can put we supply a cover as well for the retractor.
Okay. So, but the science behind that is you need to put this mask or cover to prevent the gel like evaporating outwards to condensation, or to explain that.
Yeah, correct. Yeah, just mainly just to maintain a mouth temperature.
Otherwise, it's just okay, fine. Otherwise, it's not at the optimum temperature to work.
It diffuses.
Warmer, the better. The
Diffusion better.
Diffusion.
Understood. Yeah. Okay, fine, makes sense. So I now understand how it can work into a patient's lifestyle. You've educated me that it's 2 hours apart, twice a day, just half an hour. But when you are presenting this to the patient, yes, there's lifestyle factors to consider. It's like, what do you want and stuff, which makes sense. But do you pitch it to the patient that one is more effective than the other? And my part two of that is, are they priced differently?
They're priced the same.
Okay, makes sense.
Even though there's a higher lab cost with the trade system, but the main pitch is about their lifestyle. So if they're willing to wear it during work, like if they can wear it during work and don't need to talk in their job, then the tray system will suit them.
Trayless will suit them.
Tray system.
But they
You
don't.
can keep wearing it while you
talk. If they need to talk, yes.
Yeah, if they-
Okay, if they need to talk, yeah.
and they can work with it as well.
Yes.
So you can do it at during the
day, during the job.
Yeah. But then if you like to do everything like you're whitening at home and you like to have half an hour rest, you want a shorter wear time, then go for trayless.
Okay.
Is that
I agree with that. Yeah, totally.
Okay.
So it's up to the patient to be very honest with you. I mean, both of them will work, but with the tray system now, I have to tell the patients that you have to keep your tray very, very clean. Otherwise, it doesn't work.
And I really appreciate, I'm more than happy on this podcast to always say, you know what, I'm going to take this away and change it, because I don't emphasize enough the keeping the trays clean, because it makes sense. If your trays get manky, then the gel has to now whiten two things, the tray and the teeth, right? And it's like dissolving away the chemical goodness.
Yeah.
So one takeaway now is that, yes, I'm going to consider trayless. It makes a lot of sense to me. But if the patient opts for a tray system, just emphasize a bit more on tray hygiene.
Exactly.
That's a good takeaway actually for me.
Basically, the science behind it is very easy. It's your hydrogen peroxide. It comes in contact with the bacteria. It will start to break down. It will kill the germs and break down, form bubbles for oxygen. And if you use that to form, if it's forming oxygen already, then there won't be any free radicals to attack the stains in your teeth. So
what's the best way for patients to clean? I know we're a little left field here, but dentists will like to know that they're giving the correct instructions to patient. Should you use a brush? Should you use a retainer cleaning tablet? What's the best way to keep your trays clean?
I think it's a combination of two. I would brush the inside of the trays really well with soap and a toothbrush, and also soak that retainer when you're not using into a Denture Bright tablet.
Like Retainer Bright or Denture
Retainer
Cleaner.
Bright,
Okay.
Yeah, exactly.
I would advise them to use traceless.
Advise you use trayless.
If you cannot keep the trays clean,
Yeah.
use trayless.
Fine. If they've got a night guard that's manky, maybe that patient, look, I've seen your night guard. Maybe we should go for trayless for you. Okay, fine. And now what percentage of your patients, since you've been learning about the trayless and then you've been offering it to your patients, what percentage end up going for either based on your recommendation for oral hygiene, etc., or based on what the market is wanting? and the type of patients you'll have, because we all know that if you work in one postcode and another postcode, the demographic of the patient will dictate very different type of dentistry do.
Yes.
But in just your personal experience, what percentage of your cases end up being trayless versus with tray?
Almost, I would say now, since 2024, almost 90% of my cases are trayless.
Cool.
And there is still a place for the trays, and I'll show you later. But I almost don't use it unless I have to.
Okay.
Yeah. So that will be the take.
Okay. So now, before I was like, maybe there's a special case you have to use trayless on, but you've just talked about a standard A3.5 case and how the patient, you have that conversation. So positioning, we talk about pricing, and saying, we talk about protocol. And so what can we expect in terms of the protocol and how, what kind of result to expect with this system and how many weeks it takes? So talk us through this scenario. So the A35 patient, how long, what's the protocol? How long does it take in terms, and then how often do you review them? What do we expect with this trayless system?
So with this trayless system, our protocol is 3 to 4 weeks from A3 to B1. Okay. So this patient,
And again, 3 to 4 weeks of doing it twice a day, half an hour, or conscious, or up to half an hour if you're doing conscious bleaching, right?
Yeah.
And this is with, can you use any gel? Like, can it be carbamide peroxide? Can it be hydrogen peroxide? Does it have to be Wyman's gel? Can I use the other gels? You know, how does it work?
I haven't tried it with other gels, to be very honest with you. I've only used Wyman's gel.
Yeah.
And Wyman's gel is 6% hydrogen peroxide. I am guessing with other brands of gel, because it's acidic, it can burn the gums. But with Wyman's gel, you can still paint on the near the gums, and it wouldn't burn. And that's, I think,
Well, the thing with me, and Wyman, I'd love to hear it from you, but as someone who I've got no vested interest in your products or anything, but as someone who's thinking out loud, I don't know of any other whitening companies that have a protocol for trayless. Like, hey guys, here's the protocol for trayless. You have a protocol for trayless. You've obviously thought about it and formulated in that way. So I think there is a danger, I want to say danger, I don't want to over-egg it, but there is a consideration that we should have of using any old gel where actually they always have designed it from the very start to how they work to all the results that you see on their social media pages have been delivered with a tray. And therefore there is no established protocol is one consideration I will plant for you.
Okay, it's very good question. I said there are hundreds of products out there, and we're using 6% hydrogen peroxide within EU, especially in the UK, because of the law, the legislation. But outside EU, we are using outside EU and UK, we are using 10% hydrogen peroxide, which is a stronger gel. And I've been working on the formulation for a long time. That's why I studied my PhD in teeth whitening as the efficacy and safety of teeth whitening processes. Efficacy, that's what I look at. Yes, a lot of gel, they can try to use the trayless system. I think other system, they have got it as well, like a strip. We can call it a tracer system if you wanted to. They use it for half an hour, twice a day as well. And they work, so different formulation. So the way I formulate is all down to formulation. It's all down to science. So the science is to make the gel work faster. Just make it release oxygen faster. Make it release the free radical at a rapid rate. So that, for example, the 10% we only have to do it for 15 minutes. So easy. Not half an hour, because it's 6%, we need to do it longer in this country, like in China, Hong Kong, Malaysia, and USA, only 15 minutes.
So twice a day, 15 minutes.
So easy. If they haven't got time to do twice a day, even once a day, we could get you very good results. I mean, every other day would give you results.
Now, someone out there might be thinking, why not use 16% carbamide, but the science is that breaks down slower, and the whole thing is the speed, and that's why they're going for the trayless, right? So you want the most effective and fast system, and that's why hydrogen peroxide. Is there anything else, any other reason?
No, it's safe as well, because the sensitivity is literally zero. Because you only 15 minutes on the teeth. and I think 15 minutes to get to the pulp. So
Yeah.
now I'm there for 15 minutes. So that's why it's so safe.
Okay.
On pulp. Very, very safe.
Okay, excellent, fine. That was one little question I had. So yeah, let's continue with this scenario. You said 3 to 4 weeks, twice a day, half an hour to get from A3.5 to a B1.
So usually it's from A3, we guarantee from A3 to B1. In this case, it's A3.5, which is another 4 shades darker.
A3 to A3.5 is 4 shades darker.
Yes.
Okay.
9 and 12, 3 shades. Yeah.
Three shades hard.
Yeah. It's the way we arrange, not me. It's the way it was arranged to do dental bleaching when I was doing clinical studies long time ago, over 20 years ago.
Because the simple brain thinks, oh, it's only 0.5 difference, but it's actually 3 shades different. Okay, interesting. Okay, so
according to the way the expert will arrange the shade guide.
yeah.
So continuing on the scenario, the reason why we say 3 to 4 shades is that there's also science. 3 to 4 weeks. There's also science behind that. Because every one of our patients have different porosity teeth. Some patients have higher porosity, so the gel diffuse faster, and so you get better results sooner. So some patients need 3 weeks of treatment. Some patients need 4 weeks of treatment to get there.
Okay.
So yeah, so that's why we don't.
3 to 4 weeks is a good
It's a
range
good
that
range.
most patients will respond
Yes.
in a favorable way.
Yes, and we do have a test, a way to take pictures to check out the porosity of the teeth, and that will be taught in his in his course as well.
Just
You train by it.
one advice I was given is the kind of patient who, when you're doing a composite and the mouth is open for a while, and then the teeth from the dehydration go so white, that is one measure of actually this patient will get a good whitening result and they are more porous. That's one measure of it as well.
Exactly.
Yeah. Okay.
Yeah, you're on it. Yeah.
Okay, perfect.
So in this scenario, our patient is actually having quite porous teeth, so we get really quick results. So after 1 week, you can already see the teeth.
But you reviewed the patient after 1 week?
Yes.
And this is normal protocol for you?
I usually do a review 1 to 2 weeks.
Okay.
Just to make sure the patient is doing it correctly. And we're delivering results. If I see that the results in 1 to 2 weeks are not very ideal, not what I'm expecting, then I will tweak either the wear time or how the patient paint the gel.
So a technique issue.
Yes.
You know, I'm sure you agree, Wyman, that one potential flaw in the way that, in dental school is very little about teeth whitening, and then the way we do it is we give the whitening system, okay, we'll see you in 6 weeks, see you in 8 weeks, and then we see what comes back, right? Whereas this way of doing it is, yes, it costs more because it's chair time, but that's why it's priced that way, right? Because you're taking control and you're reviewing. So when I learned this years ago, that actually it's not you see them and then you see them at the end, or even, that's it. You need to review them and tweak and ramp and all these kind of things.
And that's why we actually call this scientific dental bleaching. We actually do it with science.
Okay.
That's how we record them, and like Elvis said, because Elvis know what to expect. If it's not what he expected, then we can do, just like the aligners in Mislight, then we just have to do some refinement.
Yeah.
That's how that's how we do refinement every 1 to 2 weeks.
Yes, we wouldn't send a patient off and see them after 20 aligners. You see them after 4 or 6. Okay, are we tracking well? Is everything going okay? How's your technique? Is a similar. That's a good way to think about it. So in this scenario, patient comes back 1 week later. You're seeing good, so technique is good, and you're happy. And is that what you experienced in this scenario? Yes. Okay.
So it was good. It got significantly whiter already, and that's what you expect to see. And I planned the second review.
Now, Bill, I got to jump in and ask another question.
Yes.
When I do whitening currently, inspired a little bit by you as well, but my prior knowledge is I do upper teeth only to start with, not the lower teeth, because the lower teeth are a bit more sensitive, smaller teeth, and also the patient can see the difference. In your protocol, as you prescribe it, are you doing upper and lower together or Tell me.
per lower together.
Okay.
And in fact,
And that whether doing tray or trayless is the same, yeah?
yes,
Okay.
tray or trayless is the same. And in fact, we have to ask the patient to recline 45 degrees when they're doing it. Reason being is if you don't recline, you'll find that you only whiten the upper teeth because your
Saliva
is pooling on your lower teeth. And in our saliva will have peroxidase. Breaks down the gel in like 30 seconds. So you have nothing on there. And you actually see patients that comes back with only top teeth white and the lower teeth not white at all. And then
that's a good little tip. That's a good little tip, guys. If you're, if they're doing daytime bleaching of the lower incisors, you got to make sure 45 degrees.
Yeah. And then you will know. Then you have to tweak the technique. That's one of the common questions that we have to troubleshoot. Yeah.
Okay, fine. So then tell us about finishing off the protocol and how, at 4 weeks you finish and that's it. And then what's the top-up protocol?
So because the patient had good resorption rate, so good porous teeth, so we only stopped at 3 weeks and it reached B1 already. So as I said, after the first week, patient's doing well, so I'm not too worried. The next recall, I set it to 2 weeks.
2 weeks later, so 3 weeks
later,
since starting.
3 weeks in total.
Yes.
And we took the pictures. It's amazing. It's B1, and patient is really happy.
Okay, perfect. So that, and then sensitivity-wise?
No sensitivity at all. Patient didn't complain of any sensitivity, and she just loves the product. Yeah.
Now with top-ups, with a tray-based system, they have their trays. We say, okay, after some months, you can top up for 3 days or something. What do you advise your trayless patients to do? They keep it in the fridge and they just top up? Like, what kind of conversation do you have about maintenance?
So with Wyman system, we guarantee a 5-year we guarantee that to the patient that in 5 years you will not go back to your original shape, even if you don't use anything. And so
and that's a scientifically backed guarantee, isn't it?
Yes. Yes. And so what we usually advise our patient if they want to keep their results, the B1 result, is to order 1 tube of gel, 1 week of treatment every year. So after a year after today, after they have gotten their finished their treatment, 1 year later, call us again, get a tube of gel, do it for 1 week, and then you will stay there.
And again, do you see the patient again, or is it something that they call and they're like in the other side of London and you post it to them? Like, how does it work?
It depends. So if the patient wants to see me, then we can see you.
Yeah.
If you are busy, you can just ask us. We as long as you come for regular checkups, we are happy to send to you. Okay. Yeah.
Yes.
Correct.
Yeah. Correct.
Yeah. Now, before we move to the second scenario, this is just a common scenario, right? A3-5 teeth. Now, I have two kind of mini questions, which I think will help everyone about this. Is you have that 7-8-year-old patient who starts to get their central incisors through and they're way yellower than the deciduous teeth. Now, we know that that's kind of expected, right? Lower incisors and whatnot as they come through, and that 7-8-year-old, the ugly duckling stage, you start to see the yellowish teeth. And what I want to know is, how much do we know about this sort of genetic element of their teeth come out just yellower, and some people just teeth come out whiter, and then it's not so much what they were eating and drinking, extrinsic staining, but can they all these patients can get the same B1 result? How do we know? What do we know about in terms of individual and genetic variability?
In terms of the color of the teeth, they are all genetic. Some people born with white teeth, some people born with yellow teeth. So I did studies in my PhD thesis. I look into that as well. So I had some idea, but my hypothesis, but it's not proven yet. So, but I've seen over 20,000 cases myself. So I probably have a good idea why, but it's not proven. This one, my hypothesis. Some people see this as born. It's to do a lot to do with the translucency of the enamel. If you go back to dental anatomy days, the color of the dentin is yellow. As you drew if you do your preparation for fillings, when you drew to the dentin, you know that because it's yellow. And then enamel is usually white color. And if you look at a tooth, we see the color is the color of the dentine reflecting through a translucent enamel. So just imagine if enamel is very translucent, you will see more color of the dentine. If enamel is less translucent, you see less color of the dentine, and this group of people have whiter teeth. And the people with translucent teeth got yellower teeth. This is my hypothesis.
But these translucent cohort, they can still expect to get, as you know, can they reach the kind of their friends who have just naturally genetically more opaque teeth, if you like, or less translucent? Can they still get a good result, or do we need to modify our consent that, hey, you got translucent teeth, so I need to set your expectations a bit more realistic? Is that kind of conversation you have with your patient?
That is another analysis that we look at also in my PhD thesis as well. Then they would look at, like I would say, we look at the porosity as well. So if your teeth, the gel can diffuse inside the enamel and it will get to the dentine, it really doesn't matter, it will go white. So we need, the whole bleaching process is to bleach the dentine, make the dentine white. When the dentine is white, when they look at
because that's what gives the color to the dentine.
Exactly. Once you get the dentine white, it doesn't matter if your teeth is translucent or less translucent or more opaque, it will go white. It will stay white. It's the color of the dentine that we need to deal with.
Okay.
We need to whiter.
Got it. Now, before we go a bit more advanced with the next three scenarios, I'm really enjoying just talking about the most common scenario we see, which is the A3.5 shade. So let's just wrap up with that. And the question I have here is something that you mentioned before we hit the record button, which I just found really fascinating, right? You said the patient picked their shade.
Yes.
Right. So the way I've done it and I've been taught is you show the patient their shade that they are, and you show them that, okay, we can get you to, or you give that, here's what B1 would look like, shade tab next to the canine, and this is kind of a reference to where we want to get you to. Okay. You're saying that, okay, the patient picks B1 or picks A1 or picks a bleach shade. Tell us more about this interesting variation of the protocol, which now the more I think about it makes a lot of sense. But tell us more about that.
Yes. So when we start, we give the patient a shade guide. Obviously, we'll tell the patient with a white corrected light what shade they are, and we give them the whole shade guide aligned by values, and they can pick whatever shade they want to get to, and I'll tell them how long you need to get there and how much it will cost. Most people will pick B1 just because it's the last shade before the bleach shades, and what we call Hollywood shades in
Bleach
here.
shades, yeah.
Yeah, the bleach shades, the OM1, OM3, OM2, and OM1 are the bleach shades, and they're what we call the Hollywood shades, the veneer shades.
Yeah.
And most people will pick B1 because it's the last shade before you get there.
So it's two-tier pricing, is it?
Yes.
So, but as you go from OM3 to OM2 to OM1, does that price increase on that as well? Or is it just the Hollywood shades is one fee and then the more natural range is one fee?
So it depends on how long you need to. So it's priced by the amount of gels you need.
Time and reviews.
Yeah. So you can say it's two-tier pricing. Actually, no, it's the same. It's the same pricing, just longer.
Longer, yeah, because it reflects the time.
Yes, exactly.
So what do you think, Wyman, on the vast majority of practices who have one flat fee for whitening for everyone? Surely that's not scientific enough.
They need to come to my course. Seriously. So they can, how to say, teeth whitening changed my life. It is one of the dental procedures is stress-free, and it's really easy to do once you know how to do. Just like learn how to ride a bicycle, learn how to swim. Once you learn how to swim and ride the bicycle, you always know how to do it. It's just learning how to do it in the first place. So we haven't given that opportunity, because I used to train here over 10 years ago. I haven't done training. And at that time, probably I can blame myself. I didn't share too much, because at that time I got a lot of plans. But now I want to share. So come to my course. I'll tell you.
In China?
In China, I will tell you everything you want to know. You can ask me any questions you want.
Okay, fine. Okay,
Yeah, back to going to picking the shades. I do that one more time on the review appointment. So when the patients do come back for review, we obviously check the shade again, and then we give them the shade guide again, and see how much they have rebound. If they're not rebound a lot, as we said, 1 tube of gel, use it for another week, we'll go back to B1. And if the patient, sometimes the patient will actually ask for whiter shades, then we can talk to the patient again about going
to the next level and be like,
exactly.
okay, so
going to the bleach shades. Yeah.
okay, and so sometimes they know that option's there, that you can always try this first and then see if you want more.
Further. Yeah.
One common thing that we have in the community, what I've seen is sometimes expectations management, and patients come back and they're not happy enough. Like, yeah, they're whiter, but I was expecting more. What are the common causes of that?
So expectation management is something, again, will be touched on his course, and that's very important, especially with whitening.
Anything cosmetic, yes, of course.
Cosmetic treatment, expectation management is key.
Have you heard that from a patient before, that hey, they're white, but I was expecting more? Is that something that you've heard?
Not really, actually.
Okay, because you've been taught by him and you've been doing his protocol.
Not really. So luckily, actually, so when I started, yes. So when I started with trace, yes, because the results were inconsistent. So sometimes we get really good results, sometimes we don't. And again, that is related to the tray hygiene, tray wear, the compliance of the patient. And with the gel system, you almost can see whether the patient is wearing it or not. So if they're not wearing it, you're not putting the gel on, you can tell because it's not working. Unless they have really poor oral hygiene where the gel cannot get through the plug, then you really start whitening it at first anyways.
Okay, I just want to explore more about pricing discussions and expectations and how the patient picks the shade. And I think that's given a lot of our colleagues some inspiration to really think about how you deliver whitening. I feel that our colleagues are not taking it seriously enough. Their thing is it's like a simple item. Okay, have the whitening, we'll make the tray, and everything's just used to. That's how the practice has always done it, and there's no thought or protocol or options that are given to patients, different ways of doing it. So if anything, it should inspire people to have that conversation at work and talk about how we're delivering whitening as a practice. So we've just talked about the TRAYLESS protocol, the pros and cons, so much additional benefits from recline the patient back to the whole dehydration thing, and so many other whitening pearls to discuss, formulation, alkaline, acidic. So I know we've got a lot from this, but this is the end of part 1. We're going to do part 2 and discuss 3 more scenarios. Elvis, can you tell us what are the other 3 scenarios we'll be discussing in part 2?
So we have a scenario where we have white spot lesion after ortho, we have tetracycline case, and then we also have a tooth that's yellow after RCT, after trauma.
And these are all TRAYLESS still, yeah?
TRAYLESS.
All right.
And external whitening only.
Okay, this was one of the questions of the community. Can we use TRAYLESS for internal, well, what we call internal, but obviously you're not doing internal because you're not drilling an access hole, right?
Yes.
So we'll talk a lot about how this could be used for dark teeth and single center incisor, classic one. So we'll talk about that. So do not miss part 2 next week, and you're going to be guaranteed to get additional whitening tips that you can implement to your practice. Wyman, Elvis, thanks so much for this part 1. We'll see you shortly in part 2.
Thank you.
Thank you.
Well, there we have it. Thank you so much for listening to Dr. Wyman Chan and Dr. Elvis Law all the way to the end. For those of you who are listening, there was so much to take away, and don't forget to download the premium notes later. That really helps to cement your learning. Our members absolutely love that. For those of you who are watching, you got to see the cases. I know we call them scenarios, but they were actually cases, real cases that Elvis was showing as he was describing the protocol. It was really important to me that for our audio listeners that we didn't go too descriptive, so you didn't feel like, I need to watch this, and you're able to gain so much just from listening while you're chopping onions or gardening or going for a jog. Now, I'm hoping this has whet your appetite for part 2 next week. We go deep into 3 scenarios. Again, it'll be quite visual if you want to watch it, but for those of you who listen on Spotify or Apple, you'll totally be able to tune into the whole thing, and you'll learn the protocol for tetracycline staining, white patchy teeth, and non-vital bleaching using the TRAYLESS approach. It is quite mind-boggling, and I'll always put the links in the show notes for where you can get hold of Get2Smile, which is the gel that Wyman invented as part of the TRAYLESS Trayless protocol, so that'll be in the description below. Or if you're struggling to find it, please message us on Protrusive Guidance app. It's the home of the nicest and geekiest dentists in the world. And speaking of, don't forget to get your CPD by answering the quiz below. The quiz lives on Protrusive Guidance. Head over to protrusive.app and make your account. Thank you so much, guys, for joining us here. I'll catch you same time, same place next week. Do not miss this one. Part 2 will be absolutely brilliant to cement this even further and show you 3 more case scenarios which are not easy, and how you can use trayless whitening to really enhance your whitening results.